take action that increases the deficit makes no sense to me. Mr. Chairman, I yield back my remaining time.
Gentleman's recognized. Gentleman from Texas.
Thank you, Madam Speaker. First of all, I have utmost respect for Congressman Fox from North Carolina, but her amendment's a solution in search of a problem. Graduate medical education does not do abortions. The Teaching Hospital Center program funds training for primary care residents. There's no payment for services in the law. It's about salaries, benefits, and paying faculty. Teaching health centers will pay for abortions no more than Medicare graduate medical education has paid for abortions for the last 45 years. The President signed the executive order to make all the provisions of the subject to a Hyde Amendment. All the provisions of the Affordable Care Act subject to the Hyde Amendment. The executive order establishes a set of policies for all provisions of the Affordable Care Act to, quote, ensure that federal funds are not used for abortion services consistent with the Hyde Amendment. The presidential order reinforces what we all agree on. No one is here claiming that we should use federal funds for abortion except in very limited circumstances, whether they're under this program or elsewhere. There's another layer of protection codified in permanent law under Section 245 of the Public Health Service Act. The Coates Amendment clearly prohibits the federal government from discriminating against any physician, postgraduate physician training program, or participant in a program of training in health care professions because the entity refuses to participate in abortion training. That's not an appropriations vehicle. It's not an executive order. It's the law of the land. That's why I say this amendment is a solution in search of a problem. There's not a problem with graduate medical education, whether they be teaching hospitals, whether they be community-based centers that this bill is subject to, and I yield back my time.
Gentlewoman from California.
Madam Speaker, I move to rise to strike the last word.
Gentlewoman is recognized for 5 minutes.
I rise to speak in strong opposition to this dangerous amendment. And I have with me a letter from the American Congress of Obstetricians and Gynecologists opposing the Fox Amendment to H.R. 1216, which I ask unanimous consent to have inserted into the record.
Request will be covered by request for general leave.
Thank you. Last month, the Republican majority brought us to the brink of government shutdown over its disapproval of Planned Parenthood. But here we are again, a new week, but the same obsession with reopening the culture wars. This time, instead of saying that Congress knows better than a woman and her family about her reproductive health care, this amendment takes one step further. It says that Congress knows better than our medical doctors and medical educators about what our medical training curricula should look like. This is an unprecedented restriction, one that goes against the Accreditation Council for Graduate Medical Education's guidance and against medical ethics themselves. Medical education is supposed to prepare our future doctors for whatever they may come across in their practice. This includes women whose lives are in danger due to their pregnancy, for which terminating a pregnancy is the only way that woman will stay alive. Keeping future providers from learning these procedures, and it is an option that they may choose only if they choose to learn it, puts these women at risk. Regardless of what one's views on women's reproductive rights, I think we can all agree that our future medical providers should be trained and ready for any medical emergency that they might encounter. To play politics with their education and the lives of women is an embarrassment. Madam Speaker, it is time for this Congress to learn to trust the American people, to trust our doctors, to trust our families, and to trust women. I yield back the balance of my time.
Gentlewoman yields back. Gentleman from New York.
Madam Chair, I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. I rise in opposition to H.R. 1216, the underlying bill. As a resident of upstate New York, where much attention has been given to today's special election for a congressional seat, people are saying loud and clear, hands off my Medicare. Republicans are determined again to put us on the road to ruin with their plans to end Medicare. Despite outcries from their constituents, they are pushing forward to end a program that 46 million seniors and disabled individuals depend on for their health care. This gross injustice is made immeasurably more egregious and offensive by the fact that this is being done not to balance the budget, but to expand and permanently guarantee even bigger tax cuts for millionaires and billionaires, and to give new tax breaks to some of the world's most profitable companies, including oil. I have heard a lot of talk in the last few months about the need to make tough choices these days. The average senior on Medicare earns just over $19,000 a year. About 1/4 of Medicare beneficiaries suffers from a cognitive or mental impairment, and most have at least one or more chronic medical conditions. So I ask my Republican colleagues, what exactly is it about stripping these Americans bare of their health and economic security that qualifies as tough? There's nothing tough about stealing from the poor or the weak to give to the rich. Our seniors, on the other hand, know all about tough choices. Do I buy groceries or do I buy prescriptions? Do I pay rent or do I pay medical bills? It hurts, but how much will it cost? These are those tough choices. These are life and death choices. With the passage of Medicare in 1965, we entered into a covenant with each and every American citizen. The Republican voucher plan ends Medicare. Instead, seniors will be on their own with a measly voucher and forced to buy insurance in the private market, where all decisions will be profit-driven. More profits for insurance companies on the backs of seniors. Sounds like a Republican plan to me. This new voucher program amounts to a ration card. The value of the voucher is not linked to increases in health care costs in the private market. Yet the cost of private health insurance have risen over 5,000% since the creation of Medicare. 5,000%. The analysis of the nonpartisan Congressional Budget Office has estimated that in less than 20 years, these vouchers would pay just 32 cents on every dollar that a senior would spend on health care premiums. Now, the Republican leadership has repeatedly stated that this budget gives seniors the same coverage as members of Congress. Well, as a member of Congress myself, I know that our health plans pay for about 72 cents on every dollar of health coverage, not 32 cents. America knows that legislation in Congress carries a statement of priorities and values, not purely dollars and cents. And what sense does it make to cut funding for training primary care physicians who are on the front lines not only of keeping our constituents and communities healthy, but also of lowering health care costs with early, simple treatments? I urge my colleagues to stand with our seniors and stand up for middle-class priorities. Let's defend our middle class. Let's defend our working families. I urge my colleagues to oppose this bill. And with that, Madam Chair, I yield back.
Gentleman yields back. Gentlewoman from Massachusetts. Gentlewoman is recognized for 5 minutes.
Madam Chair, I rise in opposition to the underlying bill, H.R. 1216, and to the ongoing efforts by my colleagues across the aisle to undermine our constituents' access to affordable health care. I recently heard from my constituent from Haverhill, Massachusetts, named Phil Galinas, who relies on Medicare for his health coverage. His wife's diabetes treatment and prescription drugs are also covered through Medicare, and they have both paid into Medicare all their lives through payroll deductions. He remarked to my office that there was no way that they could meet the cost of health care today without Medicare. He and his wife are not alone. Each day, thousands of seniors like the Galinas use Medicare to cover the cost of doctor's appointments, prescription drugs, as well as routine tests and treatments. Under the budget that House Republicans passed in April and that the Senate is set to consider this week, the Medicare program that seniors have relied on for more than 50 years to meet their medical needs and expenses would be eliminated. In its place would be a voucher system that pays a small lump sum to private insurers to cover seniors. Any costs not covered by that payment would fall to seniors to pay or forego coverage. My colleagues on the other side of the aisle argue that elimination of Medicare is needed to help reduce the deficit, and that the same benefits that seniors now enjoy under Medicare will be replicated in the private insurance market. Not so. In reality, their plan will result in a far lower standard of care for seniors, while trillions of dollars continue to be added to the national debt. Rather than taking steps to reduce the underlying increases in health care costs, which in turn drive up the cost of Medicare, their plan simply shifts those costs to seniors.
The value of the vouchers that would replace Medicare would not keep pace with rising health care costs, so seniors will be increasingly required to make up the difference. Just 8 years after the program starts, a voucher will cover less than 1/3 of the cost of a private health insurance package with the same benefits as Medicare currently provides, leaving seniors to cover the rest. According to the nonpartisan Congressional Budget Office, the average senior will end up spending nearly twice as much of their income on health care than under the current Medicare system. That is why AARP released a statement warning that the budget, quote, would result in a large cost shift to current and future retirees. The Republican proposal, rather than tackling skyrocketing health care costs, would simply shift those costs onto the backs of people in Medicare, unquote. Instead of focusing on cost control measures that would bring down the cost of Medicare, the budget claims cost savings, but only by passing those costs directly onto our seniors. Furthermore, because costs have typically grown faster in the private market than in Medicare, the costs faced by seniors under the Republican plan will be much higher than the costs faced by the federal government now. My colleagues have argued that seniors won't be affected by these costs for years to come, but this is simply not true. For example, the House budget immediately reopens a prescription drug donut hole for current seniors that was fixed with passage of last year's health reform law. It also significantly increases costs for seniors now residing in nursing homes and for their adult children who may not be able to afford their parents' care. Despite being presented as a solution for our deficit, the budget proposal would still add $8 trillion to the national debt over the next 10 years. These new debts are incurred in part because their budget proposal also slashes taxes for the wealthiest Americans while continuing to provide billions in tax breaks for oil companies and other preferred industries. Real deficit reduction will require a blend of spending reductions, new revenue, and additional reforms to control rising health care costs. But simply shifting those costs onto seniors by eliminating Medicare will prove as unsustainable for our nation's well-being as the current budget crisis we face. Thank you, and I yield back.
Gentlewoman yields back. Gentleman from Illinois.
Madam Chair, I move to strike the last word.
Gentleman from Illinois is recognized for 5 minutes.
Thank you, Madam Chairman. I rise in opposition to the Fox Amendment and to the underlying bill, H.R. 1216, to amend the Public Health Service Act to convert funding for graduate medical education in qualified teaching health centers from direct appropriations to an authorization of appropriations. This bill would eliminate mandatory funding that establishes new or expanding programs for medical residents in teaching health centers and unobligated funds previously appropriated to the grant program. Under policies currently being considered by some in the House majority, academic medical centers and teaching hospitals face as much as $60 billion in cuts over the next 10 years to Medicare funding for indirect medical education and direct graduate medical education. These cuts would reduce indirect medical education payments by 60% from the current level of 5.5% to 2.2%, cap direct graduate medical education payments at 120% of the national average salary paid to residents. It would reduce federal funding for medical residency training is wrong public policy. Given our present situation with the shortage of primary care and family practice physicians and the expected future growth of our population, it makes no sense for the Republicans to end the present structure of Medicare. In 2010, 47.5 million people were covered by Medicare. We have 39.6 million at the age of 65 and older, and 7.9 million disabled. The Republican budget plan is a voucher plan that would raise health care costs and would immediately create higher costs for prescription drugs for our seniors and disabled. This plan would end Medicare's entitlement of guaranteed benefits and promote rationing by private insurance companies who would make decisions on approving or disapproving treatments for our seniors and the disabled. The Medicare program is efficiently managed, devoting less than 2% of its funding to administrative expenses. Medicare has dramatically improved the quality of life for seniors and the disabled. It is the largest source of health coverage in the nation. Democrats are committed to strengthening Medicare, not tearing it down. Under the guise of reform, Republicans desire to end Medicare as we know it today. Last year, the Republicans promised the American people that jobs would be their #1 priority. Well, I ask, where are the jobs? But instead, they want to make draconian cuts to programs to help seniors and the disabled, the middle class, the poor, and the needy, and yet provide tax cuts for over $1 trillion to millionaires and billionaires. And so we ask, where are the jobs and where are the opportunities? The estimated one-year impact of anticipated graduate medical education cuts for Illinois are $144 million for indirect medical education and $39 million for graduate medical education, which totals $183 million. If there are no doctors, there can be no medical care. I urge that we vote against these measures, and I yield back the balance of my time.
Gentleman yields back. Gentlewoman from California.
Madam Chair, I move to strike the last word.
Gentlewoman is recognized for 5 minutes.
Thank you very much, Madam Chair. I rise in opposition to the underlying bill, H.R. 1216, which would undermine the Teaching Health Center program, which trains primary care physicians. Madam Speaker and members, this is just one more attempt by the Republicans to dismantle health care reform. They're going after the training of primary doctors. We need more primary doctors, even if there was no health care reform. There are many communities throughout this country who have no primary health care physicians. Our nation is facing a serious shortage of primary care physicians. Primary care physicians are an essential part of a successful health care system. They're at the first point of contact for people of all ages who need basic health care services, whether they're working people with employer-provided health insurance, low-income children on Medicaid, or seniors on Medicare. The Republicans have made it clear that they're not concerned about access to basic health care services. The Republican budget for fiscal year 2012 turns Medicare into a voucher program, slashes Medicaid by more than $700 billion over the next decade, and cancels the expansion of health insurance coverage, which was included in the Affordable Care Act last year. The Republicans' budget's cuts to Medicare are especially detrimental to current and future Medicare recipients. Under the Republican budget, individuals who are 54 and younger will not get government-paid Medicare benefits like their parents and grandparents. Instead, they will receive a voucher-like payment to purchase health insurance from a private insurance company. There will be no oversight to these private programs. We will not be able to contain the cost. We will not be able to mandate what the basic services should be. As a matter of fact, we know the stories about the HMOs and the fact that they had accountants who determined what care you could get, not physicians who had the knowledge and the ability to determine what you need. When the first of these seniors retire in 2022, they will receive an average of $8,000 to buy a private insurance plan. That is much less than the amount of the subsidy members of Congress receive for our health plans today. The coverage gap in the Medicare prescription drug program will continue indefinitely. Under the Affordable Care Act, this so-called donut hole is scheduled to be phased out. The Republican budget will allow seniors to continue to pay exorbitant prices for their prescriptions when they reach the donut hole. The Republican budget also gradually increases the age of eligibility for Medicare from 65 to 67 years of age. Madam Speaker, the Republican budget is also detrimental to Americans who depend, again, on Medicaid, including low-income children, disabled Americans, and seniors in nursing homes. The budget converts Medicaid into a block grant program and allows states to reduce benefits, cut payments to doctors, even freeze enrollment. Medicaid funding is slashed by more than $700 billion over the next decade. That is over one-third of the program's funding. Meanwhile, the Republican budget extends the Bush-era tax cuts beyond their expiration in 2012 and cuts the top individual tax rate down to 25% from 35%. According to the Center for Tax Justice, the Republican budget cuts taxes for the richest 1% of Americans by 15%, while raising taxes for the lowest income 20% of Americans by 12%. The national shortage of primary care doctors is not a problem for multimillionaires. They will always be able to find a doctor who will treat them and pay them whatever they ask for. But most American seniors need well-trained primary care physicians and Medicare benefits that they can rely on. I urge my colleagues to oppose the underlying bill, oppose the drastic cuts to Medicaid, oppose the Republican plan to dismantle Medicare. They're trying to dismantle health care reform piece by piece, inch by inch. Today, it's an attack on training needed primary care physicians. What is it tomorrow? We know that they have a strategy that includes hundreds of bills that will dismantle, again, piece by piece, Medicare reform. It's not fair, Madam Speaker and members. Health care reform so that all Americans should be covered is something that we should all support. I yield back the balance of my time.
Gentlewoman from California.
Madam Speaker, I move to strike the last word.
Gentlewoman from California is recognized for 5 minutes.
Madam Speaker, I rise in opposition to this amendment and the underlying bill, H.R. 1216. This is just the last attempt, the latest and newest attempt by the majority to stall health care reform and undermine the health security of the American people. We had barely taken our oaths in January when they voted to repeal the Affordable Care Act, now trying to eliminate Title X funding that provides critical primary care for women. And last month, they went after the funding for the health care exchanges, and they voted to cut grants for school-based health centers that serve young children. But worst of all is the Republican budget resolution that was passed last month. It rips the heart out of Medicare, eviscerates, disfigures a program that would no longer be recognized. It's one of the more radical proposals I've seen during 18 years in Congress. They want to strip guaranteed benefits and break the Medicare promise that has served our seniors so well for nearly half a century. And what do they replace it with? A voucher. A voucher that won't be able to keep up with soaring health care costs. A voucher that will give seniors no leverage in the health care marketplace. A voucher that will put older Americans at the mercy of the insurance companies. Madam Chairwoman, the CBO has concluded that the Republican proposal will double health care costs for seniors. So, if you're 54 years old today, you'll need to save an additional $182,000 to make up for the Medicare benefits you'll lose under the Republican plan. And they're not content to destroy Medicare. Medicaid comes in for brutal treatment as well. By converting it to a block grant, they would be throwing as many as 44 million Americans off the insurance rolls, eliminating coverage for the poorest people, most nursing home residents, and people with disabilities. My friends on the other side of the aisle who say we have to do this to balance the budget, they know they're wrong. I say they're dead wrong. We do not need to put seniors and low-income Americans on an austerity program in order to rein in the deficit. We do not need to shred the social net, safety net, or to squeeze the middle class in order to get our fiscal house in order. In fact, we can save taxpayers $68 billion over 7 years and expand the menu of health care choices by instituting a public option. If you ask the American people, they'd rather see some shared sacrifice in cutting spending. They'd rather see us eliminate tax breaks for CEOs who have no idea what it's like to choose between taking their medication or eating their next meal. Madam Chairwoman, I'll vote no on H.R. 1216. It's just another example of Republican negligence and callousness on health care. They clearly prefer the broken system that leaves millions uninsured, imposing crippling costs that bankrupt families and bankrupt small businesses. The majority doesn't want to solve the health care crisis. They want to exacerbate it. With that, I yield back.
Gentlewoman yields back. Gentlewoman from California.
Madam Speaker, I move to strike the last word as I rise to speak in opposition to H.R. 1216.
Gentlewoman is recognized for 5 minutes.
Under the guise of deficit reduction, Republicans, through H.R. 1216, are attempting to attack our nation's vital support system for our seniors. The Republican budget would deny seniors and those who are coming forward after those that are currently taking advantage of these benefits, health care, long-term care, and the Social Security benefits that these seniors have earned. Sunday evening, I just got back from my district, where I had an opportunity to have our annual senior briefing. And there were over 900 seniors who were there, and they were concerned. I spoke with several of my seniors in my district, and they're worried about how they, and even some of their parents who are in their 90s today, will be able to get by once Ryan Care, is what I'm going to call it, the attack on Medicare, which would destroy something we all need. By following Ryan Care and turning Medicare into a voucher program, Republicans would gradually eliminate the peace of mind that many of our seniors have grown to be able to count on. We don't want to go back to the old days of calling seniors poor and not having an opportunity to live in dignity in the last years. These fixed value vouchers, which are being suggested in Ryan Care, would not only keep up with the rising cost of health care, but it would cost seniors an additional $7,000 more per year by 2020. In California alone, which is where I'm from, under the Republican budget, seniors would pay $214 million more on prescription drugs in 2012 alone. That's next year. The Republican budget would return our country to a time when being old was something that people would be afraid of, not look forward to. The Republican budget would also turn Medicaid into a block grant system. Haven't we seen what that's done with community development block grants? It wouldn't work. Under a block grant system, Medicaid would no longer be able to support the elderly. By converting the current Medicaid system into a block grant index to inflation and population growth, Congress would shift the burdens to rising health care costs and aging populations to the states. All you have to do is look at the Los Angeles Times to see what's happening to my state, and I don't think we'd be able to help the seniors. The deficit must be addressed. In fact, I've supported many bills and amendments that have been brought forward on the other side, but it should be done in a fair way. We should not balance the budget on the backs of our nation's seniors, not after Wall Street and our car manufacturers got a bailout. I will, and Democrats will, continue to work to protect, strengthen, and save Social Security, Medicare, and Medicaid. Madam Speaker, I yield back the balance of my time.
Gentlewoman yields back. Gentlewoman from Maryland.
Madam Chair, I move to strike the last word, and I rise in opposition to the underlying bill.
The gentlewoman's recognized for 5 minutes.
Thank you, Madam Chair. Republicans have turned to the Hill after a hard week at work in our districts, really trying to explain away the plan to dismantle Medicare to their constituents. But I want to tell it to you really straight, Madam Chair, and that is that the reason that it's hard to explain is because there really is no explanation. The plan that Republicans have under consideration would indeed end Medicare as we know it. It would end Medicare, and it's just that simple. The plan would turn Medicare into a voucher system that would leave seniors paying more and more out of their pockets for health care. You know, I was out at a town hall meeting at a senior center in my congressional district. It's one, you know, where people have gone, they've come from every level of the private sector and business to enjoy their retirement, and they receive Medicare benefits. And I asked them, who in this room, a room of about 100 or so seniors, how many of you would like to go into negotiations with an insurance company about how much you're going to pay for your health care? And no surprise, not a single one of those seniors stood up. But that's exactly what the Ryan plan, the Medicare dismantling plan, would do for seniors. It would say to seniors, we want you to go on your own and negotiate with the big insurance companies. Well, we know that that can't happen for those of us who are younger, but it certainly cannot happen for our seniors. It would shift the burden onto retirees to make the system much less inefficient and increase administrative costs that are eventually passed on to all consumers. According to the Congressional Budget Office, the Republican plan would raise the eligibility age for beneficiaries from 65 to 67. And while it repeals provisions of the Affordable Care Act that are actually designed to make the system even more efficient. This just doesn't make sense, and I think that seniors have caught on. In fact, I think all Americans have caught on. And the thing about Medicare is that it isn't just about our seniors, Madam Chair. It's also about the contract that each of us, one generation, makes to the next generation. It's the contract that I've made with my mother, that my son makes with me, and it is to make sure that we're able to be taken care of in our old age because we paid into it and we pay for it. According to the Center for Economic and Policy Research, a 54-year-old worker would need to save an additional $182,000 a year to pay for the higher cost, $1,000 to pay for the higher cost of private insurance with the government elimination of Medicare. $182,000. Let's just absorb that for all those 54-year-olds. How long is it going to take you to get to age 65 or 67 and save $182,000 to pay for your health care costs? Well, we know that that would be an impossibility. And I want to tell you what's happening in Maryland, because it will happen all across this country. And it is that our seniors are recognizing that the GOP plan would require seniors to pay an additional $6,800 out of their own pockets for expenses for health care. And that's not including the fact that they'll have to negotiate and probably pay even more than that. And so at a time when our seniors are vulnerable and they're struggling and they've seen a depletion in their savings, it's really not fair to threaten them and to threaten their quality of life by ensuring that they're going to have to pay these out-of-pocket costs. So I would ask us, Madam Chair, to really examine what it is that we're asking the American people to absorb. And our seniors, you know, I was up with a group of seniors in New Hampshire and throughout my congressional district, and our seniors are saying to us, it isn't just about us, and don't count on us supporting this plan just because we happen to be over age 55. We support Medicare because we understand what it means for future generations. And so this is a link, a bond between the young people in this country who are working, our seniors and our retirees, to protect Medicare and to protect the benefits that come with it. And I would ask us on this underlying bill, I think some of my colleagues have spoken to this. We need more primary care. Already we're seeing what's happening in our system where 26-year-olds, up to 26-year-olds can be covered on their parents' health insurance. You know what that's doing? It's actually bringing down the cost. It's making sure that we actually have more resources to absorb the care that people need as they get older. And so let's not stomach a dismantling of the Medicare protections that we've known for 46 years in this country, this contract from one generation to the next generation, to ensure that our seniors who've worked so hard are able to enjoy their retirement without sacrificing everything that they have to pay the cost for additional benefits, while health insurance companies walk away with record profits, and certainly while oil and gas companies walk away with theirs. And with that, I'll yield.
Gentleman from Kentucky. Gentleman's recognized for 5 minutes.
Thank you, Madam Chairman. I rise to support the Fox Amendment, and we've been debating the bill throughout the day and support the bill. I just want to comment, I was also back home last week and went to a 100th birthday party for a group of people in northern Kentucky, in Louisville area, and part of my district that were turning 100 years old. The lady there was 103, was born during Teddy Roosevelt's presidency. And I went to do this because I wanted to thank them. I'm one that's a big believer in what the greatest generation has done for us. I'm a member of the baby boom generation. I was born in 1964. I'm 47 years old. 1946 and 1964. If you're born in 1946, you're in Medicare this year. You're 65 years old. So I wanted to thank them and let them know that what we're doing is making a sustained and secure Medicare system for them. We all know end of last week that 2024 is the date put out that that we're having Medicare goes bankrupt. And so what we put together is a real proposal for 10 years to allow people the opportunity to adjust that are 54 and younger, because there's not a member of the greatest generation. If anybody says different, they're wrong. There's not a member of the greatest generation that's affected. Matter of fact, half the baby boom is covered is not affected by the changes that we have to make a secure and better future. And I'm 47 years old. This means a lot to me because my daughter's 17. And you ask a lot of people my age, do we have a better lifestyle than our parents had? Well, the greatest generation gave us a better lifestyle than they had because they wanted us to have a better lifestyle than they had. You ask a lot of people my age, do we think our children will have a better lifestyle? It's amazing and it's disappointing how many people think today that our children are not going to have the same quality of life we had. And I didn't come to Washington, D.C. to be part of a government that doesn't address the fact that we want our children to have a better future than we have. In 30 years, when my daughter is my age, graduate from high school in 2 weeks, when she's my age, we can pay off the national debt. So think about it. I'm 47 years old, got a $14.3 trillion debt. You ask a lot of people my age, do you think our children are going to have a better future? A lot of people say no because they say that we keep piling on debt and deficits as far as the eye can see. But, Madam Chairman, you ask me now if you thought if my daughter at 47 years old is living in a country with zero national debt, do you think my grandchildren and her grandchildren will have a better future? They will. That's what we're talking about. We're talking about saving and securing Medicare for the greatest generation. We're talking about saving it and securing it for people as they become older and more mature. And so anybody that says the greatest generation is affected by this is just not saying what was passed out of the House of Representatives. If anybody's saying that seniors are affected by this, they're not saying what was passed out of the House of Representatives. To say that we have to reform the program to make it stronger and better for them, that's accurate, and making it stronger and better for those who come forward. That's what we're talking about doing. That's what the facts are. People deserve the facts. People are tired of hearing rhetoric. They want facts, and the facts are we're sustaining it and securing it for the greatest generation and reforming it so we'll be there as our children mature. And if we pass the budget, if the Senate would pass the budget as we pass out of the House, well, my daughter is my age, will have zero national debt, and will have a better future, and then ask her if she thinks her children will have a better future than she did. And I guarantee you that she will say that. I yield back.
Gentleman yields back. Gentleman from North Carolina.
I move to strike the last word.
Gentleman is recognized for 5 minutes.
Thank you, Madam Speaker. I rise to oppose the nonsensical pending amendment, the underlying bill, although the underlying bill doesn't really do all that. But most of all, to disagree with the remarks of the gentleman from Kentucky just now and from other remarks like that what the Republicans have done are not going to affect the people on Medicare now or the people who are older than 55 and older. What it does, in fact, is shift more and more of the cost of health care to people who cannot afford it, so that the richest Americans will not have to pay taxes. Will have to pay, they'll cut taxes for the richest Americans by even more, and they will protect insurance company profits and the profits of everyone else in the health care field who are making vulgar profits that are causing American health care to be twice as expensive as health care anywhere else in the developed world. The arguments and what the Republican Congress has done in these last few months have made very clear how how cynically dishonest everything Republicans said about health care in the last 2 years really was, especially about Medicare. When Democrats really did try to find a way to get control of costs without affecting the quality, the availability of care, the access to care, the quality of care, all Republicans would say, even when it was specifically and narrowly targeted at fraud, they said that we were cutting Medicare. Now we see what they really think about Medicare. And now we see how little they really do understand how important Medicare is to the financial security of older Americans, of Americans in retirement. Now, they say it will not affect you if you're over 55, if you're 55 or older. Well, I just turned 58. It's nice to know the Republicans care that much about me, but let me tell you, that's not the way it's going to work. Someone 53, just 5 years younger than I am, well, when I turn 65, I'll qualify for Medicare. Presumably, I'll get Medicare. My 96-year-old mother, who I also did visit this weekend, she will get Medicare. I feel pretty confident she'll get Medicare for the rest of her life. But when I turn 65, I'll get Medicare. The guy who is 53 now, he'll be 60. He'll be paying taxes for my Medicare. He won't be getting it. He'll never get it. He'll never get it. What he'll get instead is a coupon, a voucher. He'll get an allowance to go buy private insurance. And private insurance is simply not going to pay for what Medicare pays for. It is going to be far more expensive. The Congressional Budget Office estimates that in just 10 years, those folks will have to pay 60% of their own health care cost if this plan goes through, what they call a path to prosperity, what should be called the path to insurance company profits. In 20 years, it will be 2/3 of their health care costs. They'll be paying for it. They'll also be paying taxes, or working Americans, people who are still in the workforce, will be paying taxes. So I get Medicare, and they know that's not the deal they're getting. The deal they'll be getting is that little voucher, that puny little voucher that puts them at the mercy of insurance companies. Now, Republicans thrive on resentment. All of Republican politics seems to be built around resentment. I don't want to have a nation that filled with resentment between generations. Ms. Edwards spoke just a moment ago about the contract between generations, that just as our parents took care of us in our childhood, we will take care of our parents and their generation when they retire. We'll take care of them with our Social Security taxes, our Medicare taxes. They will get those benefits. But under the Republican plan, the path to insurance company profits, they won't get Medicare. They'll get that little voucher. How long is that going to go on before that resentment builds up? How long is that going to go on before the people who are paying the taxes for it and know they'll never get it are going to say, no, no more of this. We have got to change this. Madam Speaker, what we want is for all Americans to get the same deal. We want the people who are 65, the people who are 96 to get the same deal, the people who are 70 to get the same deal, the people who are 58 to get the same deal, the people who are 50 and 30 to get the same deal. And if you are willing, if this Congress is willing to control cost, even though that means limiting the profits of some of the people who are getting really rich from our dysfunctional health care system, we can do that. I yield back.
Gentleman yields back. Gentleman from Rhode Island.
I move to strike the last word.
Gentleman from Rhode Island is recognized for 5 minutes.
Thank you, Madam Chair. I rise in opposition to the amendment and in defense of our nation's seniors who are really under attack. And why is that? Because the current Republican budget proposal passed by this House and up for Senate consideration pulls the rug out from underneath our seniors. It ends Medicare by making huge cuts in benefits and putting insurance companies in charge of our seniors' health care, letting insurers decide what treatment and what tests our seniors will receive. Under the Republican plan, Medicare will end. It will not only impact our seniors, but it will impact the family members of our seniors who will now have those responsibilities. It will reopen the donut hole, making it more expensive for our seniors to get their prescriptions, the prescriptions they need to keep them healthy. And under their plan, they will slash support for seniors in nursing homes while continuing to give subsidies in the billions of dollars to big oil companies. And what else? More than 170,000 Rhode Islanders in my home state rely on Medicare, and they will literally be paying to give additional tax breaks to the wealthiest Americans in our country. To make matters worse, the nonpartisan Congressional Budget Office determined that this budget actually adds $8 trillion to the national debt over the next decade because its cuts in spending are outpaced by the gigantic tax cuts for the richest Americans. Our seniors cannot afford this Republican budget. It would deny them health care, long-term care, and the benefits that they've earned. The Republicans' choice to end Medicare by cutting benefits and turning power over to the insurance company for the important health care decisions of our seniors will result in reduced coverage and exposure to greater financial risk for Medicare recipients, costing seniors an estimated $6,000 more each year for their care. The Congressional Budget Office determined that under this Republican budget, seniors' out-of-pocket expenses for health care would more than double and could almost triple. They concluded, and I quote, most elderly people would pay more for their health care under the Republican plan than they would pay under the current Medicare system. To put that into context, the CBO found that in 2030, seniors would pay 68% of premiums and out-of-pocket costs under the Republican plan compared to only 25% under current law. And it found that the Republican plan means seniors will pay more for their prescription drugs because it reopens the donut hole, costing each of the 4 million seniors who fall into that coverage gap up to $9,300 by 2020. And the conservative Wall Street Journal concluded that this plan, and I quote, would essentially end Medicare, which now pays for 48 million elderly and disabled Americans, as a program that directly pays those bills. Under the guise of deficit reduction, this Republican plan is recklessly attacking vital support systems for our seniors. We all agree that we have to address the deficit. The issue isn't whether we should do it, but how we do it. Let's repeal subsidies to big oil. Let's eliminate fraud and waste. Let's end the wars that are costing us more than $2 billion a week. But we should not be balancing the budget on the back of our nation's seniors. Our federal budget is more than just about dollars and cents. It's a statement of our values and our priorities as a country. The Republican budget reflects the wrong priorities. They would rather cut benefits to our seniors than cut subsidies to big oil or corporations that ship our jobs overseas. This Republican budget, by ending Medicare, breaks the promise we made to our seniors to protect them in their golden years. We must do better for our seniors. Medicare has met the health care needs of seniors while providing them with financial stability for more than 40 years. Ending Medicare would pull the rug out from underneath the feet of our seniors during their golden years. And I ask my colleagues, if we can't protect our greatest generation, what's next? I yield back the balance of my time.
Gentleman yields back. Gentleman from North Carolina. Gentleman from North Carolina is recognized for 5 minutes.
Madam Chairman, I've heard my colleagues give volumes of words here today, but I've seen little action. In the 4 years they controlled the U.S. House, they proposed nothing in the way of meaningful entitlement reform, nothing to preserve Social Security, nothing to preserve Medicare, nothing to improve Medicaid and ensure it's there. Madam Chairman, I ask, where is the plan of these House Democrats speaking today? Where's their plan for entitlement reform? I'd be happy to yield. Fantastic. I would say that the important thing here, I'd be happy to yield. Where's your plan on entitlement reform?
Here's one.
Madam Chairman, I would ask my colleague.
Does the gentleman favor permitting Medicare to negotiate the price of prescription drugs the way the VA does and save $25 billion a year?
Reclaiming my time, I would ask, does the gentleman favor the Medicare Part D prescription drug benefit that has a lower cost basis than what your colleagues proposed at the time of enactment? Reclaiming my time, I would say that they have lots of... I'm going to finish up here, my friend.
Okay.
I would just tell the chairman that what is missing from this discussion, lots of questions, but little substantive action, no policy proposals to make sure that Medicare is there for the next generation, much less the end of the greatest generation. I would ask my colleagues to come forward with a substantive plan, not just take up the time here on the U.S. House floor, not take away time from these important amendments that we have under this open rule here on the House floor. I would ask my colleagues to do something real and substantive rather than push us to a debt crisis, which their policies and their spending are pushing us towards. And with that, I yield back the balance of my time.
Gentleman yields back. Gentleman from New Jersey. Gentleman from New Jersey is recognized for 5 minutes.
Unanimous consent to revise and extend my remarks. Thank you, Madam Chairperson. My friend who just spoke asked us where the plan is to reduce the debt and deficit, and if he's here, I'd be happy to yield to him, but I would ask him to consider these ideas. 1, Medicare pays more than twice as much for a Coumadin pill that the Veterans Administration does, because we have a law that the majority supported that says that Medicare can't negotiate prescription drug prices. I favor repealing that law and saving at least $25 billion a year. I would ask my friend if he supports that, and I would yield if he'd like to answer.
Gentleman yields.
Does the gentleman support that idea?
Why didn't the gentleman do it when he was in the majority? And I'd be happy to yield back the balance of my time.
The gentleman, we did not do it.
Why is this not in Obamacare?
Reclaiming my time.
Everything else.
Reclaiming my time. We did not. 2 Republican senators to support it on the other side. We would have done it over here. Second thing, does the gentleman support stopping the spending of $110 billion a year to occupy Iraq and Afghanistan, and instead spend that money here in the United States? Does the gentleman support that? I would ask him if he'd like to answer that question. I'll repeat it. That we're spending about $110 billion a year to help finance the government of Iraq and Afghanistan. I'd rather see that $110 billion a year to reduce our deficit. Would the gentleman support that?
Does the gentleman support the President's war in Libya?
I frankly do not, but reclaiming my time, I especially don't support paying the bills for Baghdad and Kabul that we could be using to reduce our deficit here at home. Third, we're going to spend at least $60 billion over the next 10 years to give tax breaks to oil companies that made record profits, $44 billion last year alone, as our constituents are paying over $4 a gallon at the pump. I support repealing those giveaways to the oil industry and putting that money toward the deficit. I don't see the gentleman anymore. I'm not sure how he stands on it, but we support that. 4, I support the idea that people who make more than $1 million a year might be asked to contribute just a little more in taxes to help reduce this deficit. Now, I know the other side's going to say, well, this will hurt the job creators in America. There's an echo in this chamber. In 1993, President Clinton proposed a modest increase on the highest earning Americans to help reduce the deficit. The former speaker at the time, Mr. Gingrich, he wasn't the speaker at the time, became the speaker, said this would cause the worst recession in American history. He was wrong. The gentleman who became the majority leader, Mr. Armey, said that this was a recipe for economic collapse. He was wrong. When we followed the supply side trickle down the last 8 years under George W. Bush, the economy created 1 million net new jobs. But when we asked the wealthiest Americans to pay just a little more to reduce the deficit in the 90s, the economy created 23 million new jobs. So when they ask where's the plan, here's the plan. Don't abolish Medicare the way they plan to. Negotiate prescription drug prices. Stop paying the bills for Iraq and Afghanistan. Stop the giveaways to oil companies that make record profits. And ask the wealthiest in this country to pay just a bit more to reduce our deficit. Let's put that plan on the floor and reduce the deficit that way. I yield back.
Gentleman yields back. Gentlewoman from California. Gentlewoman is recognized for 5 minutes.
Thank you very much, Madam Chair. I rise in strong opposition to the underlying very reckless bill, H.R. 1216. The Republicans, and we've heard this over and over again, they want to destroy and to deny seniors long-term affordable health care by eliminating programs that are training the future health workforce of our country. This legislation is really part of an ongoing Republican attack on Medicare under the guise of deficit reduction and fiscal responsibility. It really is about privatizing Medicare, and of course that means that there will be some winners and there will be some losers. The Republican plan to end Medicare threatens the healthy and secure retirement that we promised American seniors. In fact, an end to Medicare is an end to a lifeline that millions of seniors rely on. Medicare gives peace of mind to millions of Americans who pay into it all of their lives. The Republicans want to give aging Americans a voucher, mind you, that will not come close to covering the cost of health care instead of maintaining and improving Medicare. Sure, waste, fraud, and abuse must be addressed wherever we find it, including the Pentagon. But we disagree with the Republican agenda that the program must be killed. The Republicans want to end this program when millions of Medicare beneficiaries are struggling to make ends meet, and when we know that Medicare-eligible beneficiaries will double over the next 20 years. Republicans have the wrong priorities, focused on letting the rich get richer on the backs of the middle class and the most vulnerable in our nation. Under the guise of reform, Republicans would increase costs for seniors and cut benefits while giving tax cuts to millionaires, subsidies to oil companies, and sending desperately needed jobs overseas. If the Republicans get their way, millions of seniors would immediately begin paying higher costs for prescription drugs. The impact of killing Medicare will be the most severe on vulnerable and underserved populations, including our seniors of color, while negatively impacting all seniors who rely on Medicare to protect their health and economic security. An end to Medicare is really an end to a lifeline that millions of seniors rely on. If Republicans have their way, millionaires will continue to get big bonuses while millions of Americans fall deeper into poverty. Madam Chair, approximately 43.5 million Americans were living in poverty in 2009. But did you know that nearly 4 million of those are seniors? Given our challenged economy, we can't expect these numbers to have improved since 2009. Medicare is part of a promise made to hardworking Americans to ensure that they would not lack the security of having health care. And so rather than stand silently while Republicans destroy a program that protects vulnerable populations, we are here to speak up and stand up for our mothers and our fathers, our grandmothers and our grandfathers, our aunts and our uncles, and yes, our young people and our children, and to be their voice in the House of Representatives. We are here to declare that Medicare should be protected and improved to protect our nation's seniors and most vulnerable populations, and we're here to say that we want to secure it for future generations. Ending Medicare really does end this promise and this security for millions of Americans today and here and in the future. So we're here today to defend Medicare and the support that it gives to our seniors. We must ensure that those who have worked hard their entire lives strengthening our nation have the health security that they need and that they deserve in their later years. Thank you, and I yield the balance of my time.
Gentlewoman yields back. Gentleman from Texas. Gentleman from Texas is recognized for 5 minutes.
Madam Chairman, I have seen shameless acts on this floor before, and we're watching another one with the last few speakers that we've seen here today. The facts of the case are, and people know this, is we passed a budget resolution which is a construct to ask this House of Representatives to consider a plan so that we do not bankrupt Medicare, which is exactly what anyone who voted for the health care plan on March the 21st or 22nd of a year ago did. The plan under which President Obama and Speaker Pelosi at that time supported took $500 billion out of Medicare to support a plan which could not be sustained either, which cost $2 trillion for health care. So this year, Republicans have a plan which would allow the sustenance to sustain Medicare with a plan that is a market-based plan. It's not about your program. Not one person who is presently on Medicare today, nor anybody that is 55 years old or older today, would be impacted by this plan. It is a plan that says we should challenge the Congress of the United States, including the administration also, to come up with a plan about how we can sustain Medicare as we do see a doubling over the next 15 years of people who will be expected to participate in that plan. So that we get this right, for once, let me say this. It is not a voucher program. It does not impact anyone that is presently on Medicare, so the shameless things we've heard today about everyone's grandmother and everybody's grandfather and all these people that will be thrown off Medicare, they will be unaffected. Here's what the plan calls for. It calls for the United States Congress to begin a process with hearings that would allow members of people who would be on Medicare to probably be allowed to have, instead of a one-size-fits-all plan of Medicare, to have a plan that looks just like what government employees would have. A realistic opportunity for them to choose among several plans, whether they want a basic plan all the way up to a plan which they could fully participate themselves. Today, Medicare is a closed, one-size-fits-all process. Just like we heard Mr. Miller, we're going to treat everybody the same way. It does not work because not everybody has the same needs as each other. We will have a plan which is market-based, which does not bankrupt this country nor the system, which will allow the individual an opportunity to come into a process and have their own health care just like somebody who works for the federal government. It would allow people who are in that program to take money out of their own pocket, to choose their own doctor if they chose to, and to be allowed to supplement those payments. We would probably set a mark, a bar that said if you make above a certain amount of money, that's not determined yet, but if you had the ability to pay for yourself, you shouldn't rely upon the government. Another way to make sure that we support the system, because if people have the ability to pay for their own health care, we should allow them to do that, encourage them to do that. And then we look at how doctors are paid. Doctors today have not only been mistreated by both sides, but in particular, as we see doctors not being compensated, they are not available, and it means seniors are being denied coverage because physicians are not being reimbursed properly. It allows us to have a great system where doctors would want to serve seniors, a great and better system that is market-based, whereby the ability that a person has to pay, if they do, then they would pay their own physician and their own way with the minimum support from the government. The bottom line is the gentleman from North Carolina asked a relevant question, and the answer that came back was, when he said, "What is your plan?" the answer that came back was, "What about the war and what about oil companies?" Well, the facts of the case are we're talking about Medicare here today, a system that is draining this country from not only its ability to provide outstanding and excellent health care, but also a system that takes away choices from seniors.